to another lecture of Dental Pathshala, where we help you understand and learn dentistry better and easy. And this video is a continuation of the Express Revision course for periodontics. And if you are interested in watching more videos like this, you can watch in the playlist of our channel and also check out the link in the description box below for the notes of this particular video. And if you are interested in watching more interesting, reading more interesting notes, you can check out our website www.x2.com. So let's get started with the today's topic, which is the periodontitis. So we'll be covering two topics, and before we get started, make sure you subscribe to the channel and hit on the bell icon so that you don't miss any of our future videos. So guys, starting with the today's topic, periodontitis. So today we'll be covering chronic periodontitis and aggressive periodontitis, which are aggressive periodontitis is a very important topic for the exam viewpoint. So talking about periodontitis, what do we mean by this term periodontitis? Perio means it is related to the gums, and don't means teeth. Itis means infection. So what happens? Inflammation. So this is inflammation. So due to the inflammation, this is an infectious disease which will result in the inflammation of the supporting tissues of the teeth. So this is a periodontitis. That means it is an inflammation within the supporting tissues of the teeth. So we are talking about the gum, PDA, that means the periodontal ligament, alveolar bones, so all these supporting structures of the teeth. So now we have got the term chronic periodontitis. See, there are two things. One is acute, one is chronic. Acute means the onset of the disease is sudden. Chronic means the onset of the disease is slow and it is occurring over some time period. So, in case of chronic periodontitis, there is inflammation, which is usually due to the infection. Now, the infection is the plaque and the calculus. So, the main cause of the infection is the plaque and the calculus. So, what happens initially? There is a plaque and calculus, which leads to the inflammation of the supporting structure. We have already covered, guys, that how the infection goes inside the gums and then it reaches the periodontal ligament and the supporting structures. So we have already covered that. Due to the bacteria, especially if we talk about the gram-negative bacteria, it releases some endotoxin, and because of this endotoxins, there is an inflammatory process which starts. And because of the inflammatory process, because we have got PMNs, and all these PMNs, they releases the cytokines. So like the prostaglandins, leukotrienes, so all these chemicals, they resorb the bone, they break down the collagen fibers of the periodontal ligament. So this is how the destruction of the tissues happen. So what then happens is the destruction of the tissues. Destruction of the tissues, especially if we talk about the PDL and the bone. So this is what we know up till now. When we talk about the chronic periodontitis, that means there is some inflammation which is occurring over time. So it should be understood that it is age associated disease, associated with the age. It is not dependent on the age, but it is associated with the age, but not dependent on the age. So chronic periodontitis is associated with the age, but it is not age dependent. So guys, this is a slow progressing inflammatory disease, because we are talking about chronic. When we are talking about chronic, that means the progression of the disease is slow. When we are telling anything is acute, that means it is sudden onset. So slowly progressing inflammatory disease. And this is the most common type of the chronic periodontitis is the most common type of periodontitis. So what are the typical features which we see in chronic periodontitis? Let's talk about the features. First of all, there is a plaque and calculus. And then there is inflammation which starts. So because of that inflammation, there is a gingival swelling, redness, ruby tumor, dollar cala, right? So gingival swelling, gingival redness, we see loss of stippling in the attached gingiva, loss of gingival stippling. Stippling is the orange peel appearance which we have already covered in the first part of the series. So we see that there is a loss of stippling. Also the marginal gingiva has got the rolled out margins. So rolled out margins. And the papilla can be crater like papilla. There can also be recession. There can also be pocket formation and bleeding on probing. Now, if we talk about the bone loss, guys, there can be of two kind of bone loss. You remember in the last part from trauma from occlusion, we have covered that trauma from occlusion. We have studied WARM, which is the widening of the PDL, angular bone loss, resorption, and M is the mobility. So, the angular bone loss, which is a typical characteristic feature of the trauma from occlusion, which is when there are excessive forces or when there is a weakened PDL. If we talk about chronic periodontitis, then we have got two types of bone loss pattern. Either it can be a vertical bone loss or it can be a horizontal bone loss. Now, horizontal bone loss occurs when there is a suprabony pocket. Vertical bone loss happens when there is an infrabony pocket, and we have covered this in the pocket lecture itself, that what is a suprabony, what is an infrabony pocket. Now guys, this is about the bone loss. So we see that there is attachment loss, or we can say the bone loss, and based on the site as well as based on the clinical attachment loss. So based on the clinical attachment loss, we can classify into mild, moderate and severe periodontitis. So mild chronic periodontitis, moderate chronic periodontitis and severe chronic periodontitis. So mild means when the attachment loss, when the clinical attachment loss is less than, that means it is between 1 to 2 millimeters or less than. So less than 1 to 2 millimeters. Then we call it the mild periodontitis, chronic periodontitis. When we are talking about the moderate chronic periodontitis, that means the progression of the disease is not much. So it is kind of a moderate level. So that means the clinical attachment loss has occurred up to 3 to 4 millimeters. Then we have got, guys, the severe. So severe chronic periodontitis is when the clinical attachment loss is more than 5 millimeter, more than or equal to 5 millimeters. So this is the severe. Based on the site also we can classify the chronic periodontitis into two parts. One can be a localized chronic periodontitis, and it can be generalized chronic periodontitis. So guys, localized is when we talk about that the lesion or the disease occur in a specific area. That means in a specific site. So based on the number of teeth involved, you can say, or based on the site, you can say, when it is less than 30% of the site involving the chronic periodontitis, that means less than 30% of the teeth shows attachment loss, bone loss, then we call it the localized chronic periodontitis. When it is more than 30% or more than 30% of the teeth or of the site are involved, that means more than or equal to 30% of the teeth or the side shows attachment loss, bone loss, then we call it the generalized chronic periodontitis. So we have already covered that what happens, guys, there were this progression of the disease, there were some models. So initially it was used to believe that there is a continuous model. So in a continuous model, they say that the disease progression is a continuous. That means from the start of the disease up till the end of the disease, there is a continuous progression of the disease. So over the time period, the progression of the disease remains the same. But there is another concept, we call it the random or the episodic burst model. So episodic burst model says that there are short outbursts of the destruction of the disease, then the disease progression stops. So there is, this is what we have talked about in the pocket itself, that there is a period of exuberation and then there is a period of quiescence. That means there is a period of destruction followed by the period of no destruction. Destruction or no destruction, then destruction, some amount of time there will be destruction, then there will be no destruction for some time. So that means this is the random or the episodic burst theory, you can say. Then comes the model, multiple burst model. So multiple burst model says that the disease occur in the burst of multiple periods of. So multiple periods of destruction, then multiple periods of inactivity of the disease. So multiple period of active and then multiple period of inactive, then multiple period of active, like that, multiple period of inactive. So this is the multiple burst model. So these are the models of the disease progression. Now always remember that periodontitis is an age associated, it is not age related. It is associated to the age, but it is not related to the age. Now guys, what are the bacteria which are involved in causing the chronic periodontitis? So we have got the red complex bacteria. And we have already covered this in the plaque itself, that what are the red complex bacteria? If you remember, the red complex bacteria, we have three bacteria, which is the T square P. So we have got T for Forsythia, then T denticola, and then P gingivalis. So these are the bacteria which are associated with the chronic periodontitis, which are our red complex bacteria. So guys, coming to our next topic, which is of aggressive periodontitis. It was earlier known as periodontosis, and this term was not very popular because so many in 1966 there is one world workshop of perio, and there it was said that this term should not be used anymore, it should be excluded. So periodontosis term was excluded, and it is also known as juvenile periodontitis or periodontosis. So Chaput and Butler in 1967, in the next year, they gave this term the juvenile periodontitis because of its association with the age, because of its association with the pubertal age, because since the onset of age for the localized aggressive periodontitis, which we will be covering soon, is circumpubertal, so which is associated with the puberty. So that is why it is also known as the juvenile periodontitis. So Bayer in 1971, he gave certain things, he told certain things about the periodontosis. So he told that there is a rapid bone loss. So in 1971, Bayer redefined periodontosis. He said that this periodontosis is a rapid bone loss around the molar teeth. Rapid bone loss around more than one permanent molar teeth. And he described it, there are forms of it. He described the two forms. One is the localized. So he said localized periodontosis is when it affects the incisors and the molars, first molars, especially the first molar. The first molar. And generalized is when most of the dentition is involved. And up till now we follow this classification. And he also stressed out that in case of aggressive periodontitis, the local irritant is not equal to the amount of destruction. So he said that the plaque is less, but the destruction is more. So both are unequal. And he also said that a disease had a circumpubertal onset, and he also told that it has got a familial background. That means genetics involvement is what do we see in case of aggressive periodontitis. He also said that this disease can be self-limiting. So in 1972, in the next year, Forel coined the term periodontal syndrome. Now guys, so in 1989, the World Workshop of Clinical Periodontics, they said that a periodontal disease can be classified based on certain situations, like based on the age of the onset of the disease, and also we can classify the periodontal disease based on the rate of the destruction, or we can say based on the progression of the disease and how many site this disease is involving. So what is the intraoral distribution, if there is any systemic involvement, if there is any superimposition of the systemic complications, or the host and the host factors, the microbiological factors, and response to the periodontal therapy, how the prognosis is. So they classified into, so this is about 1989 World Workshop classification. So they classified into 5 categories. One is the adult periodontitis. Then they said early onset. Then early onset was also subclassified into prepubertal. Prepubertal was also subclassified into pubertal, was also subclassified into localized and generalized. Then they said in the early onset, that means early diseases. One is prepubertal, before the puberty. One is juvenile, which is circumpubertal, close to the puberty. So localized, generalized. And also they said rapid, one more form, which is the rapid progressive. So rapid progressive periodontitis. One is the adult periodontitis, then the early onset periodontitis. Then they said periodontitis can be involved with the systemic, we call it periodontitis associated with the systemic disorders. Then they said necrotizing ulcerative periodontitis and the refractory periodontitis. But this classification was actually so difficult. So certain clinician, they said that this should be changed, and finally in 1999 AAP group suggested that this classification should not be based on the age, it should be rather based on the clinical as well as radiographical and all the lab findings. So clinical finding they said are more important as compared to the age, and they reclassified into aggressive periodontitis. They reclassified the aggressive periodontitis into just the localized and the generalized form. So localized and the generalized form. Well guys, the characteristic feature of aggressive periodontitis is there is a rapid bone loss, since the name suggests that it is aggressive in nature. When it is aggressive, that means it is acting harshly, destructing all the tissues. So there is a bone destruction that we see in case of aggressive periodontitis, and also there is a rapid attachment loss. So the attachment loss is very rapid, as the name suggests that it is a aggressive disease. And also there is a familial, or we can say the genetic inheritance, so familial aggregation related to this disease. So these are the typical important features. There are certain other features, like there is increase in the AA committance. Sometimes in some patients there can be increase in the P. gingivalis also. So the common features of aggressive periodontitis, there is rapid attachment loss, destruction of the bone, because since this is aggressive in nature, generally it affects less than 30 years of age group. And there is a familial inheritance, so that means there is a genetic predilection and there is destruction of the bone. So aggressive in nature, that means it is destructive in nature, there is a destruction of the bone. Also we see increase in the AA committance, and some patients we see that increase in the P. gingivalis also. So P. gingivalis, we know that it is a bacteria of the red complex, one of the bacteria of the red complex. Red complex we have studied T square P, and this is the bacteria which are associated with the chronic periodontitis, which we have just now covered. And since guys, there is an inflammatory response and the severity of response is such that it is so destructive that there is a destruction of the periodontal tissues. So there is aggressive destruction of the periodontal tissues, that is why we call it the aggressive periodontitis. So we see that there are phagocyte abnormality, there is hyper response of the macrophages, there is hyperproduction of the prostaglandins, interleukins, and in some cases there can be this disease can be self-arresting. But usually it is, we see that associated with all these features. So talking about the localized aggressive periodontitis. So guys, localized, we have got two forms, right? So the localized form and the generalized form. So the localized aggressive periodontitis, which is, we are going to write LAP, localized aggressive periodontitis. So what does this name suggest? That the nature of the disease is in local area. So that means it is not affecting the whole dentition. That means it is affecting the specific teeth. And aggressive in nature, this is a form of the aggressive periodontitis. That means there is a rapid attachment loss, bone destruction, and also there is a genetic predilection. So all these features associated with the local area. So if we talk about localized, that means certain teeth are involved. So what are the teeth which are involved? The first molars and the incisors. So these are the teeth which are generally involved with the localized aggressive periodontitis. So which is a first molar and the incisors. So there can be, along with that, at least there can be interproximal attachment loss on two permanent teeth along with the molars or incisors. So one of which is first molar and involving no more than two teeth other than the first molar and the incisors. So this is localized. Now if we talk about why there is involvement of a specific number of teeth, why not whole of the teeth are involved? Why only the first molar and incisors we are talking about? Because after colonizing first molar and incisors, this AA committens, which is the major bacteria for the aggressive periodontitis, has to fight the strong immunity from the host. So it has to fight our body, and the bacteria antagonist to the AA colonize the oral cavity and checks its growth. So AA committens, it loses after a certain time period its toxigenicity. So it loses its leukotriene producing ability. So this bacteria, guys, what happens? This bacteria, once it affects the molars and the incisors, after that the host body immunity, it start taking action. It start fighting to the bacteria. it start fighting to the AA commitants, and after some period of time this AA committance loses its ability to destroy the tissues, so it loses its leukotoxin producing ability. And also we see sometimes a defect in the cementum formation, which may cause the localized nature of this disease. So basically the two teeth which are involved are this, you have to remember that the first molar and incisors are the most common teeth, along with that at least two permanent teeth. So the important feature of the localized aggressive periodontitis. So first of all, localized aggressive. So remember L for localized aggressive, which is the lack of the inflammation. But still we see the pocket. We don't see the inflammation, but still we see the deep pocket. But still deep pockets and bone loss. And guys, very important thing, the bone loss here in case of localized aggressive periodontitis is arc in shape. If you can see here guys, this bone loss pattern is arc in shape. If you can see here, this is arc in shape. So this is the arc shape pattern. So let's take the other color to differentiate this one. If you can see here, this bone loss is from distal surface of the second premolar to the mesial surface of the second molar. So this is arch shape. So we can see here the pattern of the bone loss is arc shape pattern of bone loss. So arc shape bone loss is, what do we see, is a typical feature of the localized aggressive periodontitis. So we see the arc shape bone loss at the posterior area from the distal part of the second premolar to the mesial part of the second molar. So guys, first of all we have studied that there is a deep pocket, there is a bone loss. Since this is aggressive disease, so there is a rapid bone loss, destructive bone loss, right? So because of this bone loss, there is increase in the mobility related to the incisors and the first molar, again because the teeth involvement is the first molar and the incisors. So teeth mobility in the incisors and the first molar is what do we see. And because of the involvement of the incisors, we see that there is a distolabial migration of the maxillary incisors. This creates a diastema, that is the midline spacing. And also this rate of bone destruction is so severe that the bone destruction in case of localized aggressive periodontitis is 3 to 4 times more than the chronic periodontitis, because it is aggressive in nature. And during the mastication, an individual feels the deep seating dull aching pain, radiating pain during the mastication. And there is root sensitivity because of the pockets as well. So the teeth or the roots are more sensitive to the thermal as well as the tactile stimulus. So any stimulus, there is a root sensitivity, there is a bone loss, there is lack of inflammation, still the presence of the deep pockets, and there is a advanced bone loss. Bone loss is so much that the rate of the bone loss in aggressive periodontitis is 3 to 4 times more than the chronic periodontitis. And remember this, there is a arc shaped bone loss pattern from the distal surface of the second premolar to the mesial surface of the second molar. And guys, since you remember, we told you that aggressive periodontitis has got a genetic predilection. So what are the genetic factors which are associated, which is the HLA, A9 and B15 which are commonly associated, and there is a defective PMN formation. PMNs. So there are defective neutrophils. And also the monocyte are not functioning properly. So there is the functional abnormalities which are associated with the monocyte. So poorly functional monocytes. And we see that there is an increased expression of MHC class 2 and HLA DR4, and there is an altered T cell response. So guys, if we talk about the generalized aggressive periodontitis, that means we are not talking about the first molar and the incisors. We are talking about more sites involvement. When the aggressive periodontitis, when it is involving multiple sites in the mouth. So how many sites? We call it the generalized. So when there is an interproximal attachment loss on at least 3 permanent tooth other than the first molar and the incisors, plus at least 3 permanent molar. And if you remember, in the localized aggressive periodontitis, there is a interproximal attachment loss on at least 2 permanent teeth along with the first molar or the incisors. So when it is more than 3, then we call it plus more than 3. We call it the generalized aggressive periodontitis. So this is based on the site. Then aggression of the disease is same. So less amount of plaque causes more severity of the disease. And we know that there are two kind of responses. Like one is when there is a period of destruction. So that means there will be gingival inflammation, bleeding on probing, and we also see that there is ulceration, redness of the gingiva. So all these features we see when the disease is in active phase. And when there is a period of quiescence, that means there is no destruction phase, then the gingiva appears normal without any sign of inflammation. So guys, what are the differences between the aggressive and the localized and the generalized aggressive periodontitis? Let's cover the differences between both of them. So we have the localized aggressive periodontitis and the generalized aggressive periodontitis. So the localized aggressive periodontitis, the age of onset of the localized aggressive periodontitis is somewhere around the puberty. So this is circumpubertal. While on the other hand, the generalized aggressive periodontitis most oftenly see in less than 30 year of age group, but it can also be seen in the older individuals. And the antibody response against the infecting agents is high in case of localized aggressive periodontitis, while as it is poor in case of generalized aggressive periodontitis. And the bone loss or the destruction pattern, bone loss is arc shape in case of localized aggressive periodontitis. And if we see the destruction pattern in case of a localized aggressive periodontitis, so localized attachment loss we see at the incisor and the first molar area, and there is an interproximal attachment loss of at least 2 or more permanent teeth, out of which one is first molar and involvement of 2 or fewer teeth other than the first molar and the incisors. So other than that, 2 permanent molars, 2 permanent teeth. And in case of generalized aggressive periodontitis, so there is a generalized interproximal attachment loss of at least 3 permanent teeth other than the first molar and incisor, and 3 permanent teeth. So since the site, based on the site, localized means there is a local involvement, that means incisors and the first molar. And if we talk about the generalized, that means more than first molar and incisor involvement is there. So now this video lecture we have covered the aggressive periodontitis and the chronic periodontitis. So guys, aggressive periodontitis, there is rapid rate of progression. As the name suggests, aggressive, that means the disease is more aggressive. The bone loss is 3 to 4 times more than the chronic periodontitis. While on the other hand, the chronic word means that it is a long standing disease. That means the progression of the disease is slow. And chronic periodontitis often affects the older age group, that is somewhere around more than 55 years of age group. It can though even present in all the age groups, but is most commonly seen in the older age group. But if we see the aggressive periodontitis is most commonly affect the younger patients. We see that there is a pubertal circumpubertal onset of the disease that is sometimes associated, and also we see that there is a genetic predilection which is associated with the aggressive periodontitis, and the bacteria which are involved with the aggressive periodontitis is A. commitans, while on the other hand we have seen that the red complex bacteria are associated with the chronic periodontitis, which is the T square P. So T Treponema denticola, T forsythis and the P gingivalis are associated with the chronic periodontitis. So these are some of the differences. We can remember, these are the few important points which we can keep in the mind while we talk about the aggressive periodontitis and chronic periodontitis. There is no involvement of any specific teeth if we talk about the chronic periodontitis, while on the other hand aggressive periodontitis usually revolves around the first molar and the incisor teeth, and in case of localized we see that there is a arc shaped bone loss pattern from the distal surface of the second premolar to the mesial surface of the second molar. So guys, these are the few features of aggressive periodontitis and chronic periodontitis. Hope that you have enjoyed the video. So if you have enjoyed the video, give it a thumbs up. Also, you can comment in the comment section below, because this motivates me to put more videos for you guys and to make free notes available to you. So guys, for the notes of this particular video, check out the link in the description box below. Also, you can support us on Paytm as well as on PayPal to make free videos for you guys and to make free notes. So till then, keep reading, keep learning, stay motivated. I'll see you soon in the next video.